Hi everybody. I have a new process to tell you about for 2021. So a little bit of the background is that over the last year, 2020, MMMC has had an increased number of falls in the hospital. Well, this has not really been a problem for ICU. It's more so to do with the med-surg units. However, we're instituting a new process, a code fall process, that will impact our area also. So now if a patient falls, we are going to call a code fall. To do that, you just call the switchboard 8888 and let them know that you have a code fall in whichever room it's in or wherever they are. And they will announce it overhead. And then a few people are going to respond to the code fall. Myself and Alicia will respond if we're here. Our charge nurse, the primary nurse, house supervisor, PT, OT, and the hospitalist will respond. At night, it's going to be everybody except for not the manager and not PT, OT. And then what's going to happen is everybody will do a quick assessment on the patient and complete a post-fall debrief form. This is what it looks like. And the form will kind of walk you through a few things. First of all, they're going to do a trauma assessment. So if you know for sure that the patient has hit their head, or if the patient is on a blood thinner, or if it was an unwitnessed fall and the patient is over 60 years old, we are going to consider this fall a trauma. And then there's certain things that will be ordered, a stat head CT. The physician will let us know if it's with or without contrast. Actually, it's without contrast, sorry. A stat H&H, and then we need to do a Glasgow Coma scale every hour for 4 hours. And then ask for a trauma consult from the hospitalist also. That is all listed on this form. It's very clear and easy to know what to do. And then if head and neck trauma is suspected, we're going to put a C-collar on the patient and do a stat head CT on them also. And then we need to get the patient up using a backboard. So we will order a backboard for ICU, but in the meantime, we will borrow one from the ER. So the ER can bring us our backboard and we will get the patient up that way. If you haven't seen the Methodist University module about applying a C-collar, all of our charge nurses have had that assigned to them, so our charge nurse can kind of help to put that on. And then there's some other things on the form, like what could we have, what fall prevention initiatives were in place, and is there anything you can think of that we could do differently that would have prevented that fall or could help to prevent falls in the future. So the whole point of this process is, number one, we want to make sure that if our patients are potential trauma patients now after the fall, we want to treat them as such. And we want to have all the right people there to help with that. And then finally, we want to assess to see, is this something we could institute something with to prevent a similar fall in the future. This is just kind of a little guideline how to take care of a code fall, how to, all the steps to take if you have a fall. This is going to be in the bedside binder, and then this post-fall debrief form will be, I'm going to put one on each of the charge nurse clipboards, and then there'll be more in the filing cabinet listed under code. Well, I'll list it under fall, just fall. And then when this is completed, please put it in the inbox that's outside of my door. And a part of this, it's listed in here, is to complete a VERG. We actually have had some falls in ICU and a VERG occurrence report was not entered. So please just be sure that we do that also. It's important. And that's all that I have. If you have any questions at all about code falls, please let me know. I think that this is a pretty easy to understand process that should go pretty smoothly. Thanks everyone. Have a great weekend.